You are in the ring with Héctor Colon, 7-time national boxing champion turned nonprofit president and CEO. Héctor knocks out the big issues facing social services today with high-impact leaders from around the U.S. In the Ring is a creation of Lutheran Social Services of Wisconsin and Upper Michigan and produced by No Studios. And now, here's Héctor Colon.
Hello, and welcome to In the Ring with Héctor Colon, the podcast that knocks out the challenges facing the social services sector and the people we serve. I am your host, Héctor Colon. In the ring with me today is Dr. Connie Perry. She is the Managing Director of Ethica Pharmacy Advisors. Welcome to the show. We're so happy to have you.
Thank you so much.
Thank you. Can I call you Connie?
Of course.
Okay, thank you, Connie. Connie has a doctorate in pharmacy, 25 years of industry experience, critical care focus during residency, clinical roles in hospitals and academia, and part of the clinical department at the launch of Walgreens' first PBM. She was a lead consultant for national insurance brokers before joining M3. She helped launch and now leads the organization's Ethica Pharmacy Advisors team. Connie and her team focuses solely on helping employers better afford and manage their employee pharmacy plan and costs. M3 is a top insurance broker and risk management firm in America. The group helps companies manage risk, purchase insurance, and provide employee benefits. They are community leaders through and through, and we are honored to have them as our podcast sponsor. And I have seen firsthand the quality of this organization and the leadership they had as I am a board member of M3. Are you ready for round one?
I am.
Let's go, champ.
Okay.
Why should our listeners keep listening to our conversation today? And if you could share some of the stats about the problem and the need for your organization.
It's a great question. It's so relevant, Hector. When we think about pharmacy and prescription drugs, right, it is a very sensitive and important topic when we think about healthcare. Everyone has probably taken a prescription drug, right, or their family member has. And so it is a vital component to managing disease and helping with overall well-being in population health, yet it is so expensive and we have an affordability problem here in this country. So when we think about what that means in terms of a couple of statistics, years ago when we looked at the total healthcare dollar, let's say an employer was spending on their employees and their dependents, pharmacy represented maybe 10% of that dollar. And today, we're looking at 25 to 30%.
That's a big increase.
It's a huge increase. And folks will say, why? Well, right or wrong, the equation is actually pretty simplistic. What drives pharmacy cost is the average cost of the prescription, and it's the utilization of prescriptions. So folks, as we age, we're going to take more and more prescriptions. We get diagnosed with disease. We need, more utilization, if you will. So in terms of trying to manage the pharmacy spend, we have to look at it from both facets. We have to look at it from how do we reduce the cost of prescription drugs, and that's usually through negotiation work. But then as a pharmacist, I look at it in terms of how do I improve or help our clients improve access to medications, but it's got to be the right medication. So a good discount doesn't help if the medication isn't the ideal medication, like a generic, as an example, or a biosimilar. And when we look at, again, trends being so significant in the world of pharmacy, the biggest driver right now are specialty medications. And if you're not familiar with what a specialty medication is,
share, please, with the audience.
Yeah, they've been around for a while, but they're very expensive to make. They are breakthrough therapies, though. These are medications, they're often in an injectable form. The average specialty medication, just one, costs about $84,000 a year.
Oh, wow.
Yeah, so it's super expensive, and again, they're very meaningful. They're treating conditions like cancer, rheumatoid arthritis, growth hormone, hemophilia, multiple disease states for which, we didn't have therapies years ago. And now folks that are on these medications are living a great life. They're going to work and they're productive. But those specialty medications are 50 to 60% of the pharmacy spend on an outpatient basis. So we really have to focus on how do we negotiate down the price of specialty medications, but still make sure members get access. So those are some of the key statistics that we see right now in the space.
Wow, thank you for sharing that. I didn't know that these specialty drugs cost so much, and that's a significant factor of the prices increasing. But at the same time, they're really allowing people to live longer and healthier. So that's very interesting. Tell us a little bit about Ethica. Who do you serve?
We serve anyone that needs help managing pharmacy cost, which is a lot of organizations. So Ethica Pharmacy Advisors is a full-service pharmacy consultancy. Our goal is to really help employers be able to provide a quality pharmacy benefit at an affordable price for the organization and their budget, but still make sure that their members have access, right, to their medications. In today's world, because of the cost dynamic, any industry usually needs some advice. Any size of an organization needs advice. It can be a commercial population, it can be government, it can be an employer that's covering 100 employees, it can be Fortune 10. The challenges are actually very similar. What we have to do is often look at the drug mix. What is under one organization's actual drug utilization is very different than another. And so we have to look at it very differently sometimes in terms of how to manage cost and get access optimized. But in terms of who we serve, it's whoever really does want to manage cost better and understand who they're contracting with.
What would you say are some of your bigger challenges that you face along with the organizations that you work with?
The industry is under a lot of scrutiny. So, I talked about cost. That's very apparent. I look at drug utilization reports every single day.
Price transparency as well?
Absolutely. And that, you've kind of hit it right there, the transparency piece. 2024 has been very interesting, Hector. If you look at just this year, and the year's not even over, we had the Federal Trade Commission generate a report. We had the House Committee generate a very significant report. We've had the New York Times run a trilogy of articles, Wall Street Journal. They're all saying or suggesting the vendors in the space that actually administer this benefit, that cover the drugs, are they raising prices? Are they part of the problem? And that scrutiny is a challenge for us. And that's where, again, a lot of clients come to us and say, help us understand the contract. Are we with the right partner when it comes to administering the pharmacy, benefit? And a lot of it is transparency, because some vendors, based on their contract, may not actually process claims the way it's been negotiated, or at a discount that's aggressive or fair. And that's part of our opportunity, is to help bring transparency and eliminate the opaqueness that's in the space by educating our clients on what they're purchasing.
Well, thank you very much. I know organizations like yours really provide, nonprofit organizations like ours with the knowledge and expertise that helps us navigate these complex issues. Just the next question before we take a break. You have worked with numerous national organizations across your career. Why M3 and why now?
Oh, my goodness. I am so honored and blessed to be where I'm at right now. And you're right, I've worked for a variety of consulting firms and a variety of employers that I have adored. Just great learning experiences. I call them teaching moments. Every single client I've worked with, every job I've had, lots of teaching moments. It's also brought me to where I'm at right now, understanding what I feel is needed in this space, in this opaque, maybe misaligned incentives space. And so thinking about being able to be an independent advisor and build out an offering that is different than where I came from was very, very important to me. Things like independence, clinical acumen, data and technology, those are differences that Ethica brings to bear. And what is phenomenal is the fact that M3 looked at this vision and said, this is an investment not only in the business, but in our environment in the US. Like, this is a need in Wisconsin, it's a need in Illinois, it's a need in New York and California, and really has been such an amazing support for Ethica and the launch and the investment in it. And they feel wholeheartedly that this is the right thing to do and the right approach for plan sponsors across the country.
Yeah, that's great. I know Mike Vickerson, the CEO of M3, the board of directors, myself are very excited about what you're doing and that you're at M3. So thank you.
Thank you.
That's the end of round one. How you feeling, champ?
I'm feeling good.
You're doing great. We're headed into round two, but first a word from our sponsor, M3 Insurance.
People today are at a higher risk of experiencing mental illness, housing insecurity, and substance abuse. Do you know the health of your employees, your communities? How can you step up your benefits to better address their well-being? M3 Insurance helps businesses see beyond basic benefits and support employees where they live. It's a meet them where they are approach that LSS delivers to their clients every day. M3 and LSS offer real solutions to now commonplace realities that strengthen employees and inspire communities to thrive. Test your employee benefit strategy now by going to m3ins.com.
Okay, you ready for round two?
Let's do it.
Let's go, champ. So recently I had Eric Hovde and Senator Baldwin in the ring with me, and I asked them about their views on rising healthcare costs. The opponents agreed that high healthcare costs, access for patients are top barriers, and they believe that there are no real incentive for providers. When it comes to the Affordable Care Act, Baldwin says more funding is needed to support preventative services for people who might otherwise end up in a crisis and need to go to the emergency room. She believes support for navigators will also help people find the right plan, doctors, and other resources for them. Hovde says, aside from providing health insurance to people with pre-existing conditions, the Affordable Care Act needs to be overhauled because it has monopolized the system and can price services without effective oversight. Okay, I want you to stay in the neutral corner with me because both of these candidates did a great job, and I respect them both. Where do you fall with affordable health care, especially as it relates to pharmaceutical needs?
So I saw both of those podcasts and they were fantastic. So thank you again for having them on, the podcast and allowing them to speak to this. I am going to definitely stay in the neutral camp here. I see where it's very political, and it needs to be. Again, we go back to the cost component of it and the access component of it. I tend to go back to my roots, and I think about why I became a pharmacist, right? I mean, I loved chemistry, but more importantly, I felt like I really wanted to help people. And as a pharmacist, it is so fulfilling to be able to give someone access to their prescription and allow them to feel better. We have medications, obviously in the market today. Aspirin saves lives. We have vaccines that can literally eradicate disease. I'm of the mindset that every single person on this planet deserves access to that. I know it's expensive and there's an affordability issue, but there are levers and strategy that can be put into place regardless of your access to healthcare today. But everyone deserves that right.
So you talked a little bit about how people are impacted. How about businesses and nonprofits like us impacted by this?
I mean, for sure, we have to look at the cost dynamic. Like I said, specialty drugs, 50 to 60% of the total dollar, and their budgeting. They have to anticipate, what does this mean to my bottom line, the budget that I have. When we think about the government sector in particular, there's a solvency issue there too. And every year we have to think creatively about what can we do to lower drug costs and get access, so that we have a budget, to provide. And the other challenge that we are faced with is, as we look at this through the lens of government opportunities, and there's some really good things that are happening in that space, negotiating direct, right, for Medicare, the lowering of insulin cost, et cetera, things that I think are really wonderful opportunities. Unfortunately, sometimes when we lower cost on the government side, it'll balloon over on the commercial side. And again, you have to be, pretty aggressive in making sure that you're tracking and working with partners that are helping you understand what those dynamics are and how to address them quickly. So again, you've got that solvency in the benefit.
We appreciate that as a nonprofit sector, because we're essentially a break-even sector, and so we have very little margin, if anything. So for us to control our costs, pharmacy spend, relying on organizations like yours is very important for us. So thank you for all you do for our sector.
Of course.
I want to get into the Wisconsin Policy Forum. They just released a report making the case for Medicaid expansion. Do you see a benefit to an expansion of Medicaid for the clients M3 works with?
I do. Just to kind of reiterate again, we have to be cognizant about what the changes are and what expansion means. There are so many generic medications on the market today. You can easily get to 90 to 95% of all prescriptions can be available generically under a plan, and that can really provide good access and lower
90
cost.
90 to 95%. I did not know that.
Yeah.
That's a lot.
But you have to be strategic about it, right? So when we think about Medicaid expansion, you want to think about, again, what medications are available, especially in the generic world, at a low cost that can treat the vast majority of diseases. So expanding Medicaid can be doable if you look at it very strategically. So again, optimizing generics, optimizing what we have that's called a biosimilar. And biosimilars are the closest thing we'll get to a generic specialty drug. Again, those very expensive medications are going to be a great cost-saving opportunity, and we're seeing that in the space today as well. The other thing when we think about Medicaid expansion is taking a step back and looking at drug coverage. So I always like to explain and just reiterate what the FDA is here to do, right? So the FDA, the Food and Drug Administration, their goal is to make sure a drug is safe and effective. That's a pretty important job. We want the drug to come to market and be safe and work, right? But what the FDA isn't charged with is saying, okay, we have, 10 medications that lower blood pressure in this class. They're not looking at cost effectiveness or clinical effectiveness across the entire class. But yet I know if you take a medication, it'll lower your blood pressure by a certain amount. A different medication may actually lower it even further, and a third even further. Well, which of those works the best at the most affordable cost? And that's where we need to start being, again, more strategic in lowering cost and providing access, is looking at that. And we really don't have a national organizing body that does that. So we have to we have to, again, look at it from a consulting perspective, partner with vendors that do this research, look at clinical trial data, look at the universities that study this, and bring that education to bear so that we can expand Medicaid, Medicare for that matter, and make it still affordable and accessible.
What if we don't expand Medicaid? What are your thoughts about how that's going to impact us in the near future, next 1 to 3 years?
It is a concern because if folks stay uninsured, they will forego critical life-saving medications. Mm-hmm. And that just leads to higher cost. So again, as a clinician by heart, I want to make sure folks have access. And I do worry about the long stream impact of untreated diabetes, as an example. Mm-hmm. And we know what the stats look like in the United States. You know, we are a heavily overweight society, and we know that, you know, being overweight and having unmanaged diabetes leads to other complications. We do have to think about prevention. And a lot of prevention is healthy living, but it's also prescription drugs.
That's great. Yeah, we talk a lot about prevention and early intervention with regards to how we implement services in our sector, and how it's very important to prevent those problems from happening later on.
100%.
And so we're on the same page there.
Yeah.
That's the end of round 2.
Okay.
But we're going to take a break before we go into round 3.
Great.
You're doing great.
Okay, thanks.
Subscribe to In the Ring Podcast now on YouTube. Like, follow, and share on social media and wherever you get your podcasts. Doing so will allow LSS to expand our reach and message so others within our sector can benefit from these important conversations. Let's go, champs. Okay, you ready for the final round?
Ready.
Let's go, champ. What are the top 2 innovations that you're currently working on?
So excited. So I mentioned again, the learning experience I've had in my career has allowed me to really build out Ethica the way that I think it's going to be helpful for the U.S. plan sponsors, right? So the 2 top innovations that we're building out in Ethica were really important to me given the history that I've had in my past lives. So one is the use of technology. And 2 is what I mentioned previously in round 2 when we talked about really identifying what is the most cost-effective drug in a therapeutic category and how that will influence better healthcare. So let me talk to technology first. The pharmacy industry, again, can be very complicated and convoluted. If you ever looked at a PBM contract, I've seen them that
PBM,
are pharmacy benefit manager. So these are the administrators that are out there helping process claims, building out a pharmacy network, doing rebate contracting, developing the formulary, etc. If you ever looked at a PBM contract, the smallest one I've seen is probably 30 pages. The largest is 400.
Wow.
So I'm a pharmacist, I'm not a lawyer, but they can be very complicated. And one of the things that you need by your side are experts that understand what that contract language means when we get to applying the value of a deal to the prescription costs. So at the end of the day, we want a really aggressive price, right? We want a low price on a prescription drug. So when we think about how pharmacy benefit managers operate, they're very sophisticated organizations, and they can come to you and say, Hector, I'm going to give you the biggest discount on brand drugs when your members fill, at retail. Okay, that could be true, but we have to look at the full picture of claims data. So let me give you a great example of what we do and what technology can offer. I can give you a recipe for the best chocolate chip cookies ever. And I'm going to tell you, they're fantastic. Follow the recipe very closely, right? So you look at the recipe, but at the bottom of the recipe, in small font, it says, please exclude eggs and chocolate chips.
I never read that part.
That is the challenge. Many plan sponsors don't. But if you made that recipe and you excluded the eggs and chocolate chips, they're probably going to be not too good, right? That's exactly what we see in the pharmacy industry is the administrators may say, here's the contract price, but here are the exclusions. What our repricing technology does is it allows us to take all that prescription claim detail and actually identify those individual claims that are excluded. So we can very accurately help a client determine which PBM, which pharmacy benefit manager, actually has the strongest pricing for their specific utilization. And I said earlier, drug mix is so important. If you have a lot of specialty medications that your members need, I want to make sure that those drugs have very good discounts. I need to know if they're in the calculation or not. Technology allows us to do that. That is very unique. There are not a lot of consulting firms in the U.S. today that have the technology to reprice claims based in this fashion. So that's innovation number one. Innovation number two, again, is having that clinical acumen, having pharmacists engaged to say, of the cost for this category, we think coverage could be better and lower cost. And you may find for migraines, as an example, that the oldies are goodies. The generic medications that can help with migraines are just as effective as what you see on commercials today that are advertised by, the movie star community, if you will. And so that's how we help our clients make good decisions. And those are very innovative concepts that we're bringing to bear right now.
Who will these innovations impact most?
It can positively influence everyone, both the plan sponsor and the beneficiaries being your members, your employees, and their dependents. The technology that I mentioned for repricing, since we've launched the firm, we've done multiple RFPs, request for proposals, to renegotiate the price of prescriptions. And using the technology, we're averaging 23% savings. So that's 23% savings off of the drug spend. So there is still waste and excess cost in the system. And we know that just by doing those types of projects. When we look at repricing, depending on what the member pays, let's say for a prescription, maybe it's $5 or 10% or whatever the case may be. If the price of the drug is lower, they may see the value of that at the point of sale. They may go to their pharmacy and say, wow, I paid $20 last month. We have a new contract. Now I'm only paying $10 because that value of that negotiation came through to that member. But it also means you as a plan sponsor, a fiduciary, you're also saving money. We see the same thing on the clinical effectiveness side. That savings is about 20%. They're very different, which is nice, so they can be supplemental in value.
What is it going to take you to scale this innovation besides being on this podcast?
That's my goal. I'm hoping for controlled growth. Again, it's been amazing and humbling to see the need that plan sponsors have for Ethica services. And I want to do everything, though, at an A level. And I've always been a good student, and I continue to hope that will continue. So I think, getting the word out, speaking engagements, podcasts, and things like that. One, I want to educate folks that, we exist and we're here to help. We know we're successful because we're already seeing the fruits of some of this innovation. But at the same time, I want to grow so that we always can perform and provide the best service. And so, we're going to hire over time. We've already been hiring, which is exciting. But I think controlled growth with success is going to be our business mantra.
That's great. Thank you. That's the end of round 3.
Okay.
But before I let you go, I want to see how you bob and weave.
Oh, no.
And roll with the punches. And answer the following questions with the first thing that comes to mind.
Oh, my.
Are you ready?
Okay.
Okay. What book are you reading now?
I am reading Oh my gosh, I'm blanking on the name of it. It's actually the book on Carolyn Bessette Kennedy, her biography. So it kind of tells the story of her life, even as a child, even before she met JFK Jr. And I'm kind of a history buff, so I love books like that.
That sounds interesting. I have to check that out.
I think it's called Once Upon a Time.
Okay. All right. Good. Hot chocolate, coffee, or tea?
Coffee.
Me too. What are your words to live by?
Appreciate every second.
Awesome. Thank you. Favorite live theater performance?
Hamilton.
Nice. Final question. What's your game plan for spreading the word about our sector and the important topics we talked about here today?
It's like going to church and speaking the gospel. I think it's just really, it's speaking about it, publishing, and having folks see the results and let them also be the beneficiary of spreading the word. And I think it comes naturally if you do a good job and you do right by people, then I feel fulfilled and it will naturally come. But I think there is a great need for helping people get the medications that they need, and there's a great need for better affordability in the country as well.
Well, thank you so much for getting in the ring with me today.
Yeah.
Your thought leadership, your partnership, you're a true blessing. Thank you.
Thank you, you too. I appreciate it.
As always, you can find all interviews on our podcast website. Subscribe to In the Ring on YouTube and follow us on Twitter and LinkedIn so you don't miss any of these important updates and interviews in the future. Thank you again, Connie, and thank you to our sponsor, M3. Con mucho cariño, with much affection. Bye.